Virender Yadav, Civil Surgeon, that means Chief Medical Officer. District is Gurugram, and as you are aware, Gurugram or the Gurugama is the Millennium City and the IT city of North India, and but the biggest district and city of Haryana. For CAPID, and if I say the involvement of the CAPID or the NGO, etc., whatever, if I say not only CAPID and otherwise also, the NCD camps इससे पहले जो हम कर रहे थे, that we were doing only by our ANMs, and the day were fixed for that. Maybe if you say 2 parts, it was done in 2 parts. One part was of doing clinic for diabetes and hypertension, and one thing was geriatric. So 2 days a week, if I say Tuesday and Friday, usually Tuesday we will used to do diabetes and hypertension screening and maybe other things of NCD, and exclusively we were handling geriatric patients for all their ailments on Friday. Otherwise, as such, if I say there was nothing in NCD as such initially when NCD was started. But later on it was extended to other things, particularly when cancer part was involved. Then during the visit of maybe the female, they were asked or the screened for maybe breast cancer or the cervical cancer. Maybe only questionnaires were there or the questioning was there, some sort of screening. And then further it was expanded. Those who visited the PHC only or the civil hospital or the sub-divisional hospitals, then we added via. Earlier only this thing was this thing, and maybe for this was via for the cervical cancer, and for breast cancer, if I say we were involving maybe self breast examination, we were promoting through the what should I say, there are certain kind of meeting, Mahila Manch or Mahila meeting, something in our PHC and UPHC are there. There we were teaching these things, that's all. Initially NCD was limited to this. If we talk pre-CAPID and the post-CAPID, if we can compare these two things, the involvement before and after the involvement of CAPID. Initially, as I told you, NCD was maybe limited to days were fixed, and even if I say the number of patients may be less and were screened out less, and our staff was also a bit busy, as you are aware of COVID. And last 2 years we were too engaged in not only in COVID vaccination also. So the NCD was maybe even screening for cancer was also lagging behind, and even in the cancer registry we were lagging behind too much. If I say vis-a-vis, if I compare roughly, if I compare in detail, we can talk later on, but at least I can say right now, screening improved up to 5 times after involvement of CAPID, and that too only last 2 months, if I say, rather than 4 months, though we are involved in this process together more than 4 months, but in last 2 months only the screening has rapidly or exponentially increased up to 5 times. And other thing was initially the staff was not involved, and now the staff is also involved, maybe because of the training or the motivation which CAPID to provide to them, and the support CAPID which could give not only in training but in other parts, in IC, in transport, etc., which we can discuss later. And because of this, I can see a sea change in screening and what should I say, maybe NCD in overall in NCD. If I see, or if I say rather than if I see, I I say and I tell you that both even breast cancer, cervical cancer, even all kind of cancer, we all know that they are usually diagnosed very late. So it is the best thing to diagnose them early so that they can be treated fully or the cure can be provided. Less requirement of maybe chemotherapy or radiotherapy, etc. And the lesser will be the complication if early diagnosis and intervention is done. As you are aware that maybe just 5 years back, if I say, or maybe 10 years at the most, cervical cancer was the leading cancer, at least in India, as far as women are concerned, or they considered. Still in the other few parts of the country, maybe northeast side, still cervical cancer is one of the major cancer. Again, it's a hidden phenomena. If I say, it takes time because most of the time the female, they usually, in what should I say, usually they don't discuss such things even if they have some discharge, etc. And even they are not even aware, they are not even educated. No information is, IEC, if I say improper, is provided to them that what is normal, what is abnormal. Same thing if I say about breast cancer. Again, they were not aware of how to do self-breast examination, or even the society is not mobilized, and even the female is not aware which kind of lump is normal or which is abnormal, or what are the changes which are normal in your breast, etc. So the way CAPID has provided training to not only our employees, ASHA and ANM, rather the IEC done by the CAPID, it has not only motivated our staff, but the village and the other for slum area, the female are also now have been made aware that even if you are asymptomatic, you should go for screening. And we all know prevention is always better than cure, so we can diagnose it early if we screen asymptomatic. And not only up to this level, as far as I know, you are pressing hard and asking not only me, rather other NGOs and the government for maybe even vaccination to prevent what should I say, at least cervical cancer. Still it is the second leading cancer, cervical cancer, if I say, and now the breast cancer has become number one. So as far as female is concerned, the women are concerned, so we should do, not only me, not only Gurugram District, rather the whole state and the country should look into it. The way things, what should I say, has improved after CAPID. Why some, I will not say only CAPID, but any NGO if needed, if we involve somebody. See, in the last few months, if I was saying, though you are involved with us more than 1 year, but in last 4 months or so, or in this year if you say, we together, you and the CAPID and the health department has conducted more than 130 camps. We screened almost 10,000 women, and we did almost 7,000 via, and almost 100 pap smear you have done. And not only this, oral cancer we have detected or suspected in 6, and even breast cancer we have around 25 breast cancer we have suspected. So there is an impact. Suddenly things change, and as I told earlier, it is almost 5 times in last 4 months, and overall maybe by the end of the year it can be 10 times in this year itself. So I will suggest and I will ask my colleagues and not only take along CAPID or some other NGO along with you, with them, sorry, and so that we can improve not only in screening and what should I say, OPD, etc. or IC. You also helped us in transportation, which was very important part, because at times government is not able to provide transportation things. Other thing was, as repeatedly I was saying, IEC, which helped and motivated suddenly, because people have started coming because of the IC activities which was done by CAPID. And just before this, I was also mentioning about the vaccination part. So we need to not only involve you, rather we need to discuss with our authorities and all the colleagues, not only at the district headquarters, with medical colleges, so that we can make a plan for cervical cancer vaccination at least, and maybe very soon we may see a indigenous, what should I say, a Indian cervical cancer vaccine. So again, we will be looking towards you and the other NGOs so that we can involve with screening and vaccination at least for such purpose, because those people are who are comfortable with you now because of your screening and what should I say, testing. Now they can be our brand ambassador, and these females, they can ask their siblings or their what should I say, younger girls to go for not only for the vaccination but for screening also. Feedback, if I say thanks first of all, because not only you did IEC, rather you trained our ASHA and a good number of ASHA, more than around 200 or around 225 usually were trained, and more than 50, rather exactly 60 our staff nurses were trained by you people. And not only you, because of the certification was given by NCPR for VIA, and they were fully trained in that. And all thanks to CAPED and particularly ACS also, the American Cancer Society, we were overall helping you and us in achieving this. So we look forward not only from CAPED or ACS but other NGOs also in future, so that we can eliminate or we can diagnose it early, so that female are more safer in the coming days.
Cervical Cancer Mukt Bharat, an initiative by CAPED India.